Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
It is no secret that this country spends an inordinate amount on health care. Some measures put that annual amount to almost 1/5 of our almost $4 trillion national budget. That leaves an epic amount of room for leverage and possibility, but also misdirection and fraud. In a moment, we will meet someone who leads an organization that has strategically placed itself at the point of aggregating buying, deploying services, implementing strategies, etc., for its partner firms that include more than 3,700 hospitals and over 100,000 other providers. Coming up, Premier, President, and Chief Executive Officer, Susan DeVore.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. On this edition of Carolina Business Review, an executive profile featuring Susan DeVore, President and CEO of Premier, Inc.
Hello, welcome to our program. Susan, welcome. Good to have you here. Thank you for the time.
Thank you, Chris. Glad to be here.
You know, it's not lost on anyone, and certainly not you, that some of the hyperbole and the rhetoric around the political season is almost entertaining. It's unbelievable. But one thing it has done, Susan, and I know you know this well, is it's brought healthcare back to the fore of the debate. It was lost in education and transportation, a lot of other things. But so as that happens now, as we get a closer look, as we see companies like Aetna and United Healthcare just saying, we're not going to play in the exchanges anymore, and it becoming more expensive for the person who pays. Is it inevitable we're going to have to wrestle with the Affordable Care Act in reform or replacement or at least adjustment?
You know, I think, Chris, it depends a lot on the outcome of the presidential election. So I think if there's a Democratic sweep, Clinton and a Democratic sweep, the train has left the station. It will be faster implementation of the existing Affordable Care Act. I think if Trump wins, and particularly if Trump has a sweep as well, and it's a Republican-controlled Congress and a presidency, I think that there will be a lot of rhetoric around repeal and replace. At the end of the day, the problems are the same: the cost problem, the safety problem, the outcomes problem, the quality problem. And so I think it will have different names. But what a lot of people don't know is that a lot of the Affordable Care Act and its component parts were bipartisan in nature. And so I think even a Republican administration will keep a lot of the provider-driven approaches to changing the way healthcare is delivered in place.
When you talk to your contemporaries, not just other chief executives, but your contemporaries at your partner firms, is there a sense of angst one way or another? If the election goes this way, this is going to happen. If it goes that way, it's going to happen. Or is there, gosh, at least there's going to be change and we can get some forward momentum or ground movement here?
I think the angst is that if it's a Republican administration, everything stops for a period of time and there's lots of uncertainty and confusion. And that's tough for healthcare systems to know what the payment models are going to be, what the delivery models are going to be. And so I think that's the angst around Republicans. Around Democrats, I think the angst is probably the train is moving so fast and providers are having to live in multiple payment models, multiple delivery models through this transition. Premier is trying to help them in that transition with our data and our services, but I think the angst is that train will be moving very fast in a Democratic administration.
So do you see yourself in Premier, are you kind of an honest broker of the debate, not just the debate, but the service, the delivery? Let's all kind of get around this idea.
I think we absolutely are. Premier sits right in the middle. You mentioned our 3,700 hospitals, our 130,000 other providers of care. We have 1,200 suppliers on contract. So we know what's happening in pharma companies, what's happening in device companies, what's happening in all of the supply side. We also work with government a lot because Premier has data on 40% of the patients in this country. And so we see a lot about what's working, what's not working, how are we reducing costs, how are we improving quality. We sit right in the middle of that, and we're sort of a third party to all of them with data. So Premier's able to really do research and to put out ideas around how to improve the system.
So is Premier a big data company? Is this about informatics?
Premier is a big data company and a performance improvement company, because we actually don't think just putting technology in or having data changes anything. If you have technology and you have data and you have wraparound implementation services, either one-on-one with a healthcare system or collaboratively. We have 300, 400, 500 healthcare systems working together on common problems. And so if you really have that combination of data, technology, and services, I think we have a better chance of accelerating this transformation. And that's what we wake up every day thinking about.
So forgive me for the way this is going to sound, but I think you'll appreciate the vernacular here. So are you management consultants cleverly disguised as kind of an aggregator, or are you a shared services company? I mean, what does Premier do so well that you own so much of that business?
Yeah, it's a great question. The way we think of ourselves is there are 5,000 hospitals and healthcare systems out there. They're all doing the same things. They all need the same infrastructure. They all need the same kinds of data. If we can find a way to have them work together as opposed to work one at a time, 5,000 different ways that can't be compared, can't be connected, then we can move the entire industry forward faster. So we do view it as a shared infrastructure. But for us, infrastructure, again, is technology and services. It's not just one or the other.
Is there if you could get them all in a room and they would really listen to you,
right,
and you didn't have to sell them on the idea,
right,
what would you, and I don't want to say they're petulant children, but what would you say to them to say, if you do this one thing, you are going to save yourselves and the American population that uses this service, which is virtually everyone, X amount of dollars?
It's a great question. Premier does bring them together all in the same room in what we call collaboratives. We have 350 health systems working together. And it was that very question, was that wicked question of how do we improve the quality of health care and at the same time lower the cost? Because some people believed that might not be possible. So for now, 8, 9 years, we've been working with this group of 350 healthcare systems. And the one thing I would say is stay patient-centered, measure what you're doing, and create momentum around improvement. And we actually are working with these 350 healthcare systems, and we're measuring all in the same way, transparently. They see theirs, and they see everybody else's. Quality scores, safety and harm in their hospitals and health systems, their patient satisfaction levels, their mortality rates. And we can see across this group what really moves the improvement. And so Premier is in the middle of that, and it's all about keeping that patient and consumer in the center, measuring what you're doing transparently, and then driving improvement day in and day out.
Did you feel like you had some work to do to get them to give up what was commonly thought as proprietary information, to protect it from?
You know, that didn't happen as often as you might think.
Yeah.
I think the energy to be a high quality, safe and reliable, cost-effective healthcare system is so strong, and they wanted to know what other people were doing. So they knew if I give mine, somebody else will give theirs, I'll learn a lot more. And it's played out that way. I mean, the Premier Collaborative has documented $15 billion of savings and 175,000 lives saved or deaths prevented. 32% reduction in patients having to go back to the hospital for a readmission. So we know it works. And this is what has led us as a company to say it's about a lot more than just technology or data. It's that collaboration, that science, that performance improvement science, and that implementation.
You know, and not to canonize what Premier is, but with that kind of success across that many providers and partners, I would guess if I'm the federal government, if I'm CMS, if I'm looking for a way to make my system, the Affordable Care Act, work, I've got to think that Premier's got something here that I want.
Right.
So is there a place that Premier now eclipses past just a publicly traded under the symbol PINC, and this is what we do? I mean, how do you become some kind of pseudo public interest company that really helps the process?
It's a great question, and we often at Premier talk about ourselves as a company that has a social mission, and we're delivering it with business principles. So we have a mission and we have a margin, and the margin funds the mission, and the mission actually leads to the margin, right? And so as it relates to CMS, they value our data. They value the collaboration that Premier drives with these healthcare systems. They routinely come to us to test ideas. We were actually the test bed, Premier was, for the Pay for Performance program that Medicare has rolled out to hospitals and healthcare systems across the country. And we continue to do that with their new programs around bundling a hip procedure, for example, so that patients aren't in the middle of, I've got to pay a surgeon, I've got to pay an anesthesiologist, got to pay a hospital, I got all this confusion. We're in the middle of the design of all those programs in collaboration with CMS.
So we talked about this right before the cameras rolled here, and this idea that hospitals talk a lot about price and delivery of services for a price, and the media will as well as we do on this program, we will talk about that price. Do hospitals have do you feel like they've got a good grasp on what their cost to deliver these healthcare services and products and getting people healthy?
It varies. It varies. And what I would say is, just like the 5,000 hospitals are doing everything one at a time, they all have different ways of looking at cost. So some have standard cost accounting systems, some look at the way their charges flow and relate that to cost. There's not uniformity to it. And I think one of the things that Premier does with our data assets and technologies is we take data from all these various source systems and insurance companies and other payers, and we try to standardize it, cleanse it, normalize it, so you actually have, and they actually have, a better idea of what their cost is. But individually at a health system level, it's very challenging.
Yeah, don't you find that interesting, as large of a sector of the economy that this is, that there's not more rigor around that cost control?
You know, there's a lot of complexity in the system, right? It's not that the hospital or the healthcare system owns all the parts of the cost. Right? They own their own cost, but they have employed physicians, they have affiliated physicians, they might have all kinds of different cost structures. So it's a very fragmented and complicated system that hasn't been completely technology enabled. Remember, just until a few years ago, we didn't have electronic medical records in health systems all over the country, and we still don't have them all the way there in physician practices. So it's a journey. This is a multi-decade journey to transform healthcare.
I guess this would be a question directly to ACA, and that's not how we think. But as you answer that question, Susan, to talk about it, do we need to think differently about the utility of the system that we have? The utility of how it's provided. All right, well, let me ask you it this way. What would you say to the federal government about just a couple levers, pull a couple points out of the Affordable Care Act and say, if you considered changing this or adding that or tweaking this, the system would be an X multiple better? What would you tell them?
It's a great question. What I would say is that, and what Premier believes, is the faster we get to a global payment model, whether you call it an accountable care organization or bundled payment models or alternative payment models, there's all kinds of names for it. But the idea that providers would be given, a per capita amount of money to take care of you, and they would be incented then to get you to the right places at the right time, getting the right drugs and the right procedures, And you take a lot of the fragmentation and a lot of the perverse incentives that exist today in the fee-for-service world out. And so to us, getting there faster is the way to really unite the coordination of the healthcare system. And that's the big problem.
Yeah, I'm sorry, excuse me. So there is this is not my idea, but there was an attorney within a healthcare system that said something just off the cuff, and I found it very insightful. And she said, you know, the Chinese have it right. They pay their physician to keep them healthy, and as soon as they get sick, they withhold payment. What if there was some type of retainer that we paid a hospital for as long as we stayed healthy, and as soon as we got sick, then we withheld payment? It seemingly would be cheaper. Of course, you've got another payment that you're making, but, and I might be springing this on you, but Susan, isn't there an alternative way to look at this? We want to stay healthy and not just deal with it when we're sick.
Right. We want to incent well care as opposed to incenting sick care. I don't think you can do that at just a hospital level or just a physician level, provider level, because there are so many people involved. These are teams of caregivers, not one or the other. So I actually think this concept of an accountable care organization where a group of doctors and other providers together with hospitals, maybe together with nursing homes, are saying, okay, we are going to work together to coordinate care, and we're going to get a global payment for that, and we're going to figure out how to distribute it appropriately. I think that is the right model. And I think that's what we're moving to. And the challenge right now for healthcare providers is they have a foot in both camps. They're still getting a lot of fee-for-service payments, which have the fragmentation and perverse incentives in them, but they're also experimenting with these new models. They don't quite have the infrastructure to take that risk of the new model. And so what Premier does is help provide the technology, the data, the collaboration to help them get to that new model.
So who becomes the parent in charge of that process?
Healthcare system.
So the provider.
I don't think this works, yes. I don't think government can fix it by itself, a healthcare system. Sort of like if you go to a 5-star restaurant, do you want your meal being cooked by the health inspector or the chef?
That's
right?
A good analogy.
Right? So I don't think it can be fixed completely by government. I don't think it can be fixed completely by insurance companies, because that is a pretty pure business model and risk model. I think where you fix healthcare is inside the healthcare system with providers, healthcare systems, hospitals, and patients designing a global model for taking care of their populations.
But you think ultimately the provider, the hospital or the hospital system should be the one that rides herd over management of the whole soup to nuts?
I think so, because I don't think you can improve community populations if you don't do it that way. Because any one physician or any one hospital taking care of just a patient for part of the time with a payment system for piecemeal activities doesn't solve the challenge. I think you actually had a community level, and if you think about healthcare systems, they're in communities for a long time. Physicians, by and large, are in communities for a long time. A lot of people are transient and they move around, but those organizations are here for the long term, and they can actually take the risk of long-term taking care of people.
So how do you change the relationship between the provider and the payer, because there seems to be always a rub between those two. Of course, I'm talking about insurance companies and hospitals. How do
So across Premier, we have about 60 or 70 of our healthcare systems who have built their own insurance companies, so that they can deal with the provider care delivery and also the assumption of the risk around how they get paid. We have a lot of experimentation with insurers around how do we collaborate, how do our healthcare systems and insurance companies collaborate to lower the cost. We have a big program actually in Hawaii where we're working with the Blue Cross plan there and all the healthcare systems with a pay-for-performance model that they designed together and leveraged using our infrastructure. I think you need models like that. The challenge with that is hard for both to be really transparent.
Because they come from a place where they haven't been for so long?
They come from a place where they haven't been, and they're always thinking about the contract they're negotiating.
Okay.
And so it's hard. And so I think provider delivery systems having infrastructure to take risk Maybe they don't have to be the insurance company, but they need to be able to take the risk of the provider delivery side of the equation.
So what is the short term for insurance companies? Let's look at the payer for a second. We've seen Aetna, United Healthcare, to name just a couple. The Blue Crosses are being beat up because they're staying in the exchanges. It's a very tough place to be, I would guess, at least from the outside. So what's the short term for them?
I think the short term for insurers is they will continue to try to consolidate. They will continue to question whether being in the exchanges is the right thing to do or not. I think they'll continue to have to see premium increases because the challenge is we have 10,000 people entering Medicare every day. The population is getting older. It's not actually getting a lot healthier. And the demographics are such that the cost of health care is continuing. You said it at the beginning, you know, almost approaching 20% of the GDP. So I think healthcare insurance companies have to figure out how to partner better with providers. And in the short term, I think there will be a lot of continuing experimentation in that.
Like the Hawaii example?
Like the Hawaii example, like payers who are working with our accountable care organizations. Medicare is the biggest payer.
Yeah.
Medicare and Medicaid. I actually think commercial payers follow what Medicare and Medicaid do. And Premier is very focused on if you can build these models and they work for Medicare and they work for Medicaid, two of the toughest, most vulnerable populations, they will work for commercial insurance.
Do you think the Carolinas, you know, both North and South Carolina have refused Medicaid dollars. Do you think they will relent, will have to relent, or will eventually see that there could be some relief if they do agree to take those dollars?
So we have 170 healthcare systems in Premier in North and South Carolina, so a big issue for our healthcare systems in the two states. I think if there's a Democratic sweep of both control of Congress and the White House, most states will expand Medicaid. I think if it's a continuing divided Congress, or if it's a Republican sweep, I think the chances of Medicaid expansion are less. And so I think, again, it depends somewhat on what happens. I think the challenge, Medicaid expansion is good in that it brings people into the system. You now have data that you can manage, and you can manage the care delivery for that population. The challenge with it is it's a budget item for the state that's big and growing, and nobody is quite sure how long the subsidies will last.
Sustain.
Right? So I mean, it's a two-sided problem, but I think having them in the system where you can go to work on the cost and the quality and the safety and the outcomes is better than having them outside the system.
We've got less than 2 minutes left. What do you say the best ideas that you've heard that not haven't seen the light of day, but really haven't gotten the traction that you would love to say, you know, if we did these one or two things, the change would be just stark?
It's a great question. Premier, I think, would say that the best ideas are get to global payment models as fast as you can get there, and there's such a transition period, it's very politically charged, it's too slow. So get there faster so you can get these incentives aligned, you can get the teams working together, and you can solve the problem. I think getting to standards in healthcare IT, huge issue. We have to get there faster. It's not like banking where you have standards in technology and you can take your ATM card and put it in any ATM machine. It's very different in healthcare, and the data systems don't speak to each other, and there are not standards. We have to get to that if we want to solve this problem. There are all kinds of ideas around how to improve the quality of care. Really taking care of those chronic patients who have multiple disease states in a different way than the millennials who are very healthy. So those are just a couple of the ideas that Premier has about how we can move this forward faster.
In about 15 seconds, are you encouraged that health care will improve whomever the next president is?
You know, I have been in healthcare for a long time, 35 or more years. And I would say I've never seen momentum like this. So whether you like the framework or not, it has created significant momentum. Premier's in the middle of it.
Yeah.
The results we're seeing in quality improvement, safety improvement, mortality improvement, cost improvement, it's real.
Thank
It's
you.
very real.
Susan, that's the last word, and I wish we had more time because we've only scratched on it. Thank you.
Thank you.
Thanks for your leadership, and great
Thank you.
job at Premier.
Thank
Good
you.
to have you here.
Thank you.
Thank you for watching the program. Until next week, I'm Chris William. Have a good weekend. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.